Hello, parents. A very good evening to all of you. This is Dr. Lalit from Giggles Clinics in my own space. So, in today's video, I'll be discussing about the individual reflexes. In our previous video, I have discussed in broad about the importance of primitive reflexes and how rhythmic movements help in making our connections between the different areas of the brain, especially the limbic system and the neocortex, more efficient and better, thereby helping in integrating the primitive reflexes or the retained reflexes. So in today's video, I'll be talking about two most important reflexes, that is FPR, which is known as intrauterine reflex. FPR means fear paralysis reflex, and it is called as intrauterine because this reflex is present when the child is still in the uterus or the child is not born. Soon the child is born, this FPR gets converted into Moro's reflex, or what we call as primitive reflex. Now, in this video, first we'll be talking about the FPR. Now, FPR, the name itself suggests fear paralysis reflex. Now, this is a reflex which basically helps in protecting the body or the newborn, again, or the, I would say rather than newborn, the fetus against any danger, any sign. फॉर एग्जाम्पल इन अ मोड ऑफ फ्लाइट फ्राइट एंड फाइट, मतलब कहीं घबराहट हो या कहीं को टेंशन हो गई हो या द बॉडी गोज इन अ स्टेट ऑफ वेरी नर्वस स्टेट, this FPR gets activated and prevents the new fetus in the uterus environment. To make it more simple, when a pregnant mother is maybe exposed to कोई UTI infection हो सकता है, urinary tract infection हो सकता है, if there is a high blood pressure, अगर diabetes है या sugars बहुत ज़्यादा हैं या कोई फीवर हाई ग्रेड चल रहा है या ब्लड में बहुत ज़्यादा इन्फेक्शन आ गया है, उसके दौरान दे में बी लॉट ऑफ स्ट्रेस इन द यूट्रस, एंड बिकॉज ऑफ दैट स्ट्रेस the food supply to the child is also affected. As a result of this, the child feels that there is some danger is happening. As a result, in order to protect him or herself from that danger, FPR gets activated, or what we call as fear paralysis reflex. Is duran the child will go in a state of very isolation state in order to protect herself. So when that problem gets resolved, either by giving antibiotics or by proper approach or treatment by the gynecologist, so जब वो period चला जाता है, that FPR goes in a state of relaxation. It is not activated, becomes deactivated, goes in a state of relaxation. अब for example, ये FPR continuously active रहा throughout the intrauterine period और throughout the period जब बच्चा fetus और the uterus में है, क्या conditions हो सकती हैं? या तो blood pressure throughout बहुत ज़्यादा खराब चल रहा है, या प्रेगनेंसी में बहुत ज़्यादा कॉम्प्लिकेशंस आ रही हैं, या बच्चा बहुत ही प्री मेच्योर है, या उसके लंग्स पूरे अच्छे से नहीं डेवलप हुए, या कार्डिक इश्यूज़ हैं, या दिल जल्दी हम सोचते हैं दिल में छेद है, कोई वॉट एवर मे बी द रीजंस, या कोई सिंड्रोमिक एनॉमलीज हैं, उस दौरान FPR always remain in a state of activation. As a result, child will always remain in a state of isolation, as in a state of fear. Now, it's not necessarily that this may be the reason. Other than this, there will be a lot of important reasons which are very important from ASD point of view. It may be bad environment in the house. It may be a lot of stress. It may be physical stress. It may be mental stress. So those things, what we call as epigenetics, हमारा जो environment है surroundings का, वो कैसा है, अगर वो भी affected होगा, obviously physically we may not be able to see, but internally lot of stress may be happening in the uterus, and that stress can harm the fetus because FPR will always remain in a state of activation throughout that pregnancy. अगर throughout the pregnancy वो issues घर में रहे, या family stress or job stress or any sort of stress which may be there, or maybe a simple migraine, so that can cause a lot of activation of FPR. अब अगर वो एक्टिवेट रहेगा तो चाइल्ड विल ऑलवेज रिमेन इन अ स्टेट ऑफ फियर, वो हमेशा डरा रहेगा, ही विल ऑलवेज feel very shy, there may be separation anxieties. So this is one thing. Now this FPR gets converted into Moro's. A Moro reflex क्या होता है? It is also a protective reflex. और इसके this reflex जो होता है, it appears generally after birth and should go by the period of say 1.5 months, or maybe 2 months to 3 months, or maybe 4 months, but generally within a period of 1 year it should go away. Now अगर ये reflex नहीं जाता, that means reflex is retained and the connections between the brain and different areas of the brain and the limbic system are not very properly developed. अब जनरली मोरो रिफ्लेक्स होता कैसे है? अब मोरो रिफ्लेक्स में जनरली अगर कोई साउंड आती है, इसके 3 कंपोनेंट्स होते हैं. एक, पहले हाथ बच्चा ओपन करता है, वो एकदम झटका लेता है एंड देन इट क्लोज एंड प्रोटेक्ट्स हिमसेल्फ. फॉर एग्जांपल, अगर कोई बच्चा लेटा हुआ है, एक न्यू बॉर्न बेबी है, वो बेड पे लेटा हुआ है, थोड़ी सी भी अगर हम साउंड करते हैं, देर हमने ऐसे पिन भी मारी टेबल पे, तो वो एकदम डर जाता है. ही विल ओपन हिज हैंड एंड देन ही विल क्रॉल एंड ही विल ऐसे प्रोटेक्ट करेगा. वो ओपन करा, डर गया, एंड देन ही वांट टू प्रोटेक्ट हिमसेल्फ, तो इसलिए वो अपनी बॉडी को क्लोज करता है. एंड देन इफ वी हग अ चाइल्ड, ही विल फील कंफर्टेबल एंड रिलैक्स, because that thing gives him a sense of calmness and protection. Now, अब एक चाबी हल्की सी अगर हमने टेबल पे टैप किया, इट शुड नॉट कॉज एनी फियर टू एनीवन, बट जो न्यूबॉर्न है उसको नहीं पता वेदर इट इज अ ट्रू फियर और इट इज अ सूडो फियर. सो इसी कारण कोई भी अगर ऐसी साउंड होगी, उसको लगेगा ये मुझे मार रही है, इट कैन हर्ट मी, सो इट गोज इन अ स्टेट ऑफ प्रोटेक्शन, मीन्स मोरोज एक्टिवेट हो जाता है. अब फॉर एग्जाम्पल, अगर मैं किसी बच्चे को जिम बॉल पे रखता हूँ और उसको बोलता हूँ पीछे लाई डाउन हो, ही शुड लाई डाउन कंफर्टेबली लाइक दिस. अगर वो नहीं लाई डाउन होता एंड ही फील्स एज दो आई विल फॉल डाउन, सो दैट मीन्स ही फील्स कि मुझे चोट लग जाएगी या मैं बहुत ज़्यादा आई कैन गेट इंजरी, बट ऐसा नहीं होता. इट्स जस्ट अ फियर that he is not able to go back. So that indicates those like FPR may be or Moros may be activated. So अगर हम इसको प्रैक्टिकल पॉइंट ऑफ व्यू से देखें, what are the things which we can see in our child, those who are having active FPR or Moro's reflex? Separation anxiety हो सकती है, बहुत ज़्यादा confused हो सकता है, या he may be very anxious, he may be having lot of social anxieties, he may not be very comfortable enough to talk, he may be having a poor eye contact, he may be immediately lose down, or he may get suppose there is some sound going on in the music is going on, he may get suddenly get frightened or something I heard, although it's not a thing, it's not a something that will cause him damage, because the child is not able to differentiate between a true fear and a pseudo fear. Why? Because these primitive reflexes, Moros and FPR, that is intrauterine reflexes, are active. And why I'm talking about these reflexes? Because more than 90% of the cases in children who are on the spectrum, Moros and FPR will always be activated. Why? Because these are the most common things which we always see in our kids, like social anxiety, separation anxiety. Now, separation anxiety in a child of 1 to 2 years is normal, because in those cases Moro might be present, or or it may not be, it may have not been integrated completely. But by the child reaches up to the age of 4 to 5 years, there should not be any separation anxiety. But still, in the kids who are on the spectrum, irrespective of the severity, they may be having social anxiety, they may be having separation anxiety, they may be very anxious, they may not be able to perceive between a true and the false fear. Suddenly, if the sound comes, they may get frightened, they may react very, in a very different way. So all those things, they may get excited very easily. So they may have a poor eye contact. So all those things indicate that yes, FPR and Moros are activated. Now, there are certain set of things which we have to see in our child whether these FPR and Moros are activated or not. The very simple exercise I have told you, for example, like if we make a child of 7 to 8 years lie down on a gym ball with the back down, he should lie comfortably, but he may not be able to do that because he may feel as though I may hurt myself. Why? Because FPR will be activated. So there are a lot of other exercises, different set of exercises which we can see to check that whether this Moros is activated or not. But in majority of the cases it will be activated. Then there are certain set of exercises that how we can integrate them. So I am not discussing on those exercises. Those who are interested, they can contact us. But this video will help us to know that yes, FPR and Moros are very, very important to know that yes, these might be present in my child who is having social anxieties or separation anxieties or poor eye contact, or who is not comfortable enough, or who's having low confidence or is not confident enough to speak or communicate himself. So I hope we would be able to gain some knowledge about these primitive reflexes and FPR in this video. Thank you very much.